Straight away getting you the latest figures that have just been released on part of the Ministry of Health and Family Welfare, where India has reported over 2,47,000 fresh cases in the last 24 hours. The precise numbers being 2,47,417 fresh COVID cases. This is a 27% increase since yesterday. In the last 24 hours, where the confirmed cases of Omicron have also gone up and has crossed the 5,000 figure mark. Around 5,488 is the current tally of the Omicron figures across the nation. Now, amidst the exponential spike in the cases, Prime Minister Narendra Modi also will be chairing a key meeting with the chief ministers of all states and union territories. Straight away going across to Ananya now. Ananya, we're looking at a significant rise in the COVID-19 cases according to the latest figures that have just been released. But also on the other hand, we're looking at the Prime Minister, who will be looking into every state by state as far as he will be interacting today via video conferencing. Ananya? We'll just quickly get Ananya back with us. What is being said that this meeting that is scheduled for today as the India's overall tally that has jumped to nearly 2.47 lakh that is being reported of the cases in the last 24 hours, and a significant jump where the positivity rate from the earlier 11% has now gone up to 13.11%. This is a rapid surge in COVID-19 cases that has prompted the authorities also to impose fresh restriction and curbs, including night curfews and ban on large gatherings. Now, Ananya, who's joining us right now. Ananya, if you can hear me, the overall agenda as we are looking at another steep hike in the number of cases being reported in the last 24 hours, the Prime Minister himself will now be looking into the matter.
Well, yes, the rise in cases is becoming concern for the authorities, and remember that this is not the first time this is happening. The cases are rising for past few days. Delhi is almost at a positivity rate of, if we talk the national capital, it's almost at a positivity rate of 26.67%. And remember that this sharp rise in cases, however, the hospitalizations are low. But remember, Amita, that if cases come in such large numbers, then it is somehow a burden on the medical fraternity, and hence the Prime Minister would now be looking into it, and a review would be done as to what has happened with regards to control these cases, because in Delhi itself we've seen that restrictions are already in place. A mix of yellow and amber alert is there, where bars and restaurants have also been asked to close down, and schools and colleges were already shut. So we'll have to wait and watch as to what changes.
Right. Ananya, we'll just come back to you, because we know as far as the Prime Minister is concerned, he's been chairing high-level meetings. He just did that last week, and today also that will be held this afternoon to assess the COVID-19 situation in the country, the ongoing preparedness when it comes to the healthcare system, the status of the vaccination campaign, and the public health implications of the Omicron variant. Let's talk about the preparedness that has been made in many of those government hospitals. There, Sumi is getting us this ground report. Take a look.
Amid the rise of COVID-19 cases across the country and in the national capital as well as in the NCR region, the Government Institute of Medical Sciences has come up with the addition of 2 new control rooms to help out all the patients who are COVID positive and to clear out their queries and to battle the COVID-19 in a better way. We've been joined by Dr. Abhay Singh Tomar to help us out with the functions that go on in the control room of GIMS here in the state of Uttar Pradesh, which is located here in Gautam Buddha Nagar. So please tell us how you're helping out various patients here admitted at GIMS, and what kind of queries are you receiving on a daily basis? What is the common confusion that is going on within the patients and their relatives?
Actually, there are 2 control rooms here in GIMS. One is the ground floor, one at the 3rd floor. This control room basically concerned with the patient, those who are serious, and those who are, because it's close proximity to the ICU wards. Okay, so whenever a new patient comes, we get the file from the fluo PD, we fill up all the file requirement, and we'll see the vitals and other investigations. If the patient is stable, we send those patients to the 3rd floor where we are keeping the stable patients. Okay, and the file goes to the 3rd floor as well. And here we are making a home isolation record as well, because this time we don't have that sick patient. we are that is a very good thing to have. We are not having those kind of sick patients, those who require any oxygen or any other life support as well. So we are getting all the positive patients list. We are calling them. We are asking them what was the reason why they went for this test. Is there any family member positive, or is there any colleague is positive, or do they have any symptom? And many people go for these kind of tests because they want to travel to other country or travel to other cities as well. So if we found that they have some kind of symptom as well, if they are having any comorbidities like diabetes, hypertension, asthma and other illnesses, so we ask them, those questions as well, and we try to give them proper knowledge about this virus. Okay. In second wave, what we have seen that people at times people have tried to overtreat themselves. They have taken medication from many places. So we just make them little calmer. We tell them, okay, they need to take deep breath and nothing to worry about. If they don't have any severe symptoms, they have to follow the isolation rule. They have to take the healthy meal, sleep cycle regulation, and we tell them what medication they need to take. Instead of asking here and there and getting multiple consultations and clubbing all these symptoms together and taking at one go, that might hamper the patient's immunity as well. And this can basically increase the severity of illness as well. So these are the patient records. We are keeping the patient's name and their date of admission, their age, and we are giving them a room. And from here we monitor how many patients we are having in this hospital and how many we need to who are negative. We can discharge those patients. Okay, and we have the constant nursing staff, those who take care of each and every file that we are having in this control room. This is our control room. We have the CCTV monitoring as well. CCTV monitoring is here. We can monitor all the patients, and this is the ground floor CCTV. We have covered all the beds, okay, so that we can keep an eye on patients, okay. And this is a third floor or isolation ward where the stable patients are to be kept, okay. From here we can talk to patients as well. We have a mic system as well. We can talk to patients as well. These are the records of this is how the file will reach to our place. This is all the investigations we have, all the records, and all the medication what we are giving to the patients everyday basis. Okay, and we are and the vitals, and nursing staff will tell us the vitals of the patient, that how is their SpO2, how is their BP, and what is the sugar level, is there any fever or not. They will let them know, and we'll act accordingly. This is a proper communication between nursing staff inside or the doctors those who are inside from this control room as well. Okay, and from here we are trying to coordinate each and every management protocol. Okay, so this is how we are going ahead, and I hope in this time, like the first and second wave, we will give the best results as the way we have given in previous two waves as well. And hopefully this time this COVID wave will not cause any mortality and other kind of morbidity. This is what we are hoping for. Okay, and this is the only motive we are having right now. And Director Sir is basically motivating us in every possible way. He is saying I am ready for everything at midnight as well. Whatever time you require, I will be there. So he is keeping an eye on each and everything. Every day he comes, he asks how many patients we have called, how many patients we have interacted with, how many patients came positive. Even if a doctor comes out to be positive, they are taking a proper care. They are keeping them inside. Even their family members are also being properly attended here in the hospital.